So you've written your protocol, you've defined your research question, you've defined your population, you've defined your inclusion and exclusion criteria, you've chosen the data to collect, you have protocol approval, and you are ready to start. That leads us to accrual and retention. So once you have your recruitment plan in place, what are the ways to monitor accrual and to monitor retention? Accrual, or rate of accrual, is defined as how many participants are enrolled per day, per week, per month, etc. So this will depend upon the duration of your study and the type of disease or population you're studying. So if you're studying a rare condition, recruitment might be slow, so monthly reports might be sufficient. If you're recruiting a common condition, then weekly or daily reports might be needed. You also have to have a full understanding of your power and sample size estimation. So how many people do you need to answer this question adequately with enough evidence and also enough sample size to control your standard error? You also need to have an understanding of how many centers you will have recruiting if this is a multi-center study. It is often said that the quickest way to cure a disease is to open a trial for recruitment. All of a sudden, all of the people that you are expecting to be screened and randomized have suddenly vanished. It is not necessarily a great predictor to look at people with that condition seen in your clinic. As we know, less than 2% of people in a lifetime will participate in a clinical trial. So if you have 100 people in your clinic that would meet, in general, your screening eligibility criteria, you're looking at 2 of them potentially being willing to participate in your study. If it's a rare disease and there are very few treatment options, you may have a higher response rate for recruitment, but do not rely on the numbers in a clinic of the patients and assume that 100% of them will enroll in the study. So you will be responsible for measuring rate of accrual. You will also be responsible for measuring retention and attrition. Retention and attrition are the percentage of randomized participants that stay in the study, that's retention, and that drop out, that is attrition. You'll also need to track why and when participants exit your trial. This involves a lot of regular reporting, and this is where your statistical team does a lot of their work. If your data system is built in an effective and an efficient and in a timely manner, and if you only pay your sites when they've entered the data, you should have relatively real-time information on the status of the participants. If you have long stretches of time between when you see a patient or a participant in the clinic, you may want to consider contact through texting, through telephone calls, through online contact in that interim time period so that you can retain contact with the participant. Consider monthly newsletters for your participants and your centers to help increase the connection that the participants have with their clinical site. When it comes to the reports that you'll be generating, the timing of those reports is likely going to be mandated by your funding agency. At the very least, you have annual reports due to your IRB and the FDA if it's an FDA study. But generally, your funding agency is going to want monthly or more frequently provided reports on screening, screen failures, so people who were screened but did not randomize. You'll want randomization numbers, and you'll want retention numbers, and you'll want dropout numbers. You, or likely your study statistician, who will have an automated generated report. So on a weekly basis, they pull down the data, they open a statistical program, and they produce hopefully a very readable graph or table for everybody to look at. This may be more regular than requested by external agencies in your specific study. I generally recommend that it should be weekly so that you can keep an eye on those numbers and address problems as they arise rather than in an annual basis. An example of a report, a generic report here, you can see on the vertical axis is the number of participants randomized. On the horizontal axis is the recruitment date range, and this one happens to show from January 2005 to March 2009. And it's shown by quarters here. This is the duration of a study. The figure shows this one very simply the number of screened participants, that is the middle short dashed line, the number of randomized participants, that is the solid line at the bottom, and then the estimated recruitment, and that is the wider dashed line on the top or on the left side. So you can see the estimated recruitment goal was 1,000, and it was anticipated that it would take under a year or a year and a half, basically 18 months to recruit. However, you can see that it actually took from January of 2005 until April of 2009. So it took 4 years to fully recruit this study. You could include on here a site breakdown, though if there were 60 centers, you couldn't have 60 lines. That's better shown in sections, either in multiple tables or in multiple figures. You could look at the adjusted estimations. So once this study knew that it wasn't going to be able to recruit this quickly, you could see how the estimates changed. You could add screen failures on here. So you would see actually that the screen failures are simply a difference between the number screened and the number randomized. And then you could also show below the number randomized the number of dropouts. So this was a trial that recruited 1,000 participants, and ultimately just over 700 completed the full duration of follow-up. So there are many different ways. This is a very simple way to look at it, but it does give you an idea of what the rate of accrual and what the rate of attention. It does give you an idea of what the rate of accrual. Jesus. This is a very simplistic view, but it does give you an idea of the rate of screening, the rate of randomization or accrual, the rate of retention, and you could actually add in here the rate of attrition.